All right, you guys, welcome. Another Sunday night. Shawn Poe here, Sioux Falls, South Dakota. Super excited about the format that we've been rolling the last couple of weeks. Getting a little bit of blueprint training along with product education from an expert, usually from the medical field. This format, like I said, is different. It is new. We're experimenting with how we can get you the nuts and bolts of this training so we can get back to the business and uncomplicate some of the complexity that we've rolled into the business over the last couple of years. So with that, I am very thankful that we are approaching the end of February. We are seeing warmer weather in sight here in South Dakota. It was actually high 60s earlier last week, and then we ended up with a blizzard hitting at the end of the week. So we probably had a change in temperature of roughly 50, 60 degrees almost overnight. Michelle and I, we were headed to Minnesota during the blizzard. Should have taken us about 3.5 hours to get to a dance competition for one of our daughters, and instead it took about 5.5. And fortunately, we only went into the ditch once, so we are ready and anxious for spring. I'm going to be talking tonight on the invite, giving you some nuggets on what we've seen and been taught over the last almost 6 years now. It'll be 6 years that we joined Lifevantage at the end of March. So although we've learned a lot over the last 6 years, we're still continuing to learn this industry, the ins and the outs, and how to really keep this simple, how to get proper duplication going in your group. So with the invite, the first thing that I want to talk about is how you can actually integrate your databasing with the invite. And what I would suggest that you do if you haven't done this already is take your database and put it into 2 columns. Now, the first column is going to be your typical name that everybody puts into their database. But the second column is where most people, they haven't taken that extra step. But I find it very valuable for the next part, the invite, if you do this with your database. So make a second column in your database and put why next to the person's name. So the first column is going to be the name. Second reason is going to be why. After you've gone through yourself or working with a new distributor and getting as many names put down as possible, I'm talking 100, 200, 400 names, not 20, 30, putting everybody that pops into your head, grabbing all the contacts out of your phone, putting pen to paper and getting these people down. That second column of why is where we're looking at next. Now with this why, you're going to have people, I think, fall into one of 3 categories. Now you might think of people because they have specific health reasons going in their life, somebody they know's life, their family, something that they're worried about. But a health reason might pop into your head. Another category that could be part of this why is going to be a business reason. Maybe they're no longer satisfied with their job, or they're complaining about their employment or lack of employment, or wanting something else, doing something different, things like that. So business reasons. And then the third spot that you're going to have, the third category underneath the why, is it's blank. You don't have a reason why you thought of the person. Their name just came to you or was in your contact list and you wrote them down. So now with these 3 things, here's what you're going to do. That third category that I just talked about, the blank, you need to rekindle that relationship. You need to go out and talk and ask a lot of questions, get together with this person, either, over a cup of coffee, a beer, on Facebook Messenger, but just start getting back in contact with them and asking them lots of questions. You can use the form, the acronym FORM, where you're asking them questions about their family, their occupation, things they like to do for recreation, money questions, things like that, to start to uncover and redevelop that relationship, so that at some point in time you can fill in this why as either a health reason that you thought of them or a business reason that you thought of them. So I want to give you 2 specific examples of what I'm talking about using this method in your databasing. So 2 names that I wrote down, I put down Scott and I put down Josh. Let's say these are 2 guys that I've known since high school. And the first one, Scott, the reason why I put him onto my database, or why he popped into my head, is because Scott is a person that ever since I've known him, everything that he does in the business world seems to turn to gold. Okay, the next one was Josh. I put Josh's name down, and it was more of that health reason that I put his name down. Everybody that I've ever talked to in Josh's family, it seems like, has had a heart attack by the time that they're 40. And so heart disease is very prevalent in his family, and I wrote down heart disease next to Josh. Now, what I'm going to do with this is make it into a very simplistic invite that's related to the person I wrote down in my database. And we're going back to, we're showing people the ABC primetime video to do the heavy lifting, and we're inviting them to see the ABC video for a very specific reason based on them. It's not that I want them to watch the video, they need to watch the video. So here's what that kind of invite sounds like. And you can just, it's almost like Mad Libs. You know, when you were a kid, you write down the adjectives and the adverbs and the nouns, and then all of a sudden you've got a filled in story. And that's the same thing that we're doing here with your database, is you're finding wording that works for you, wording that sounds like you, and just plugging in the name, plugging in the reason, and inviting them to the information. So here's what I used to do, and I still do with new people that I put onto my database, is I'm taking that name and the reason why I put in that second column, and I'm plugging it into this. Okay. Hey, Scott, you popped into my mind because everything that you do in the business world always seems to turn to gold. You've got to check out this ABC primetime video. It's going to blow you away. Okay, so I'm plugging in the name, I'm telling him why I thought about him, and he's got to watch this ABC primetime video because it's going to blow him away. Now, when I tell that to Scott, he's not coming back and saying, is this an MLM thing? Is this, a supplement, or, asking me about superoxide dismutase or Dr. McCord or anything like that, because that wasn't in my invite. He doesn't know if I'm showing him a funny YouTube video or what it is. He just knows, because he's a good business guy, there's something that I want him to see. And it's the same thing with that health related reason. When I put down Josh and heart disease, here's what it sounds like when I call up Josh. I'm saying, hey, Josh, ever since I've known you when we were 18 up until now, it seems like every single person that I've met in your family has heart disease by the time that they're 40. There's this ABC primetime video. You got to check it out. It's going to absolutely blow your mind. Okay. Now, it's not about me. I took it off of me. I put it onto the person of the database, the reason why they need to watch the ABC primetime video. And then we're simply following up with them as they watch it, scheduling the time. We're not just sending them the link, but we're inviting them to check out the link, see it. They're not asking a bunch of questions because they don't know really why, other than you're excited. There's a reason that you just told them they need to watch it, and getting that video in front of them. So just to reiterate what I was just talking about, if you don't have a reason, rekindle the relationship enough, ask enough questions that you can find out a reason how to invite them, and then find the proper wording that sounds like you. What I just said might sound like you, but for most people it probably isn't. You're going to have to tweak that wording a little bit, the verbiage, but put it into something that you can just naturally say to people right off the cuff. That you're super excited about what you have, what you have your hands on, and the reason they need to check out the video. Then the second part that I want to talk about on the invite is when you start going off of your database and you're just outside your house doing the general things that we do throughout the week. Recently, I heard the phrase, don't go out to prospect, but you can prospect while you're out. And I think that that's very important, because whenever we're out in front of other people, it provides us opportunities that we can get the invite out to people, as long as our ears and our eyes are open to what we're seeing and what we're out doing. So don't go out to prospect, but you can prospect while you're out. And specifically what I mean by that is, let's say you go out to the grocery store and all of a sudden you're in the produce section and the lady next to you is complaining about her back, or she's, complaining that her knee hurts, something like that. And then you can use the if I would you format to invite her to listen to the information. Okay. She's complaining about her knee, and you overhear that and you say, hey, I just heard you saying that your knee's hurting quite a bit. If I had something that potentially could help with that, would you want to know about it? Okay, so you're asking permission to get the video in front of them. Most people are not going to tell you no. They don't want to find out how they can feel better. So again, keeping your eyes and ears open to what people are saying. Texting. Now with me, it's very easy to text my friends something very simple to see what they're up to. Right? That's not outside of the normal activities that we're already doing, and it doesn't feel weird to them that if I text one of my friends and say, hey, what are you doing this Thursday night? If they're doing something, they're going to tell me what they're doing. If they're not doing anything, they're going to tell me they're free, they're available. And so how you can translate that into the invite, let's say I call up my friend Matt or text him and just say, hey, Matt, what are you up to Thursday? If Matt texts me back and he says I'm not doing anything, he's going to watch the video, okay? Or he's going to listen to the opportunity presentation that we have coming up. What I would do is I would do something like this is then once you know that he's available is text back and say, hey, great. I'm super excited about this new venture that I'm doing. I just really want your feedback and your opinion on it. Could you listen to something for a half an hour and then give me your feedback afterwards? And that's a very soft, gentle approach to getting somebody to give you feedback and hearing the information. And that's honestly a lot of what Michelle and I did early on building our business was, we didn't grow up in Sioux Falls, South Dakota. We lived here, but we didn't grow up here. So most of the people we were contacting lived in other places. And we were calling them up on the phone, asking them if they were going to be free on Thursday night. If they told us no, we were getting them onto the Stu Brody, Carrie Dickey Thursday opportunity call. And sometimes we'd actually three-way them into the call. We'd listen with them, or we would just call in separately from them, texting them right before, hey, you jumping onto this, and then giving them a call right back after that opportunity presentation was done on the phone, and then going through the rest of the motion. But these are very, very simple, soft techniques to use to get people in front of the information so you can find out if they're a yes, a no, or a maybe. And here's one that I think you can use with close friends and family is talking to them, whether it's via text or calling them up, is just saying, you've always supported me with everything that I've done. I'd really appreciate if you would check this out and see what I'm so excited about. Very soft approach. Again, getting them in front of the information is really what our ultimate goal is. So these are just basic techniques that you can integrate into what you're already doing. Start with that database though. Go back. Your database should never ever be shrinking unless somebody joins your business as a distributor. Okay. So take that database that you've already developed, work on getting more people on the database, get that second column of why you think about them, and then make it about them as you invite them, and keep it very basic and simple. We often overcomplicate this by telling people too much information during the invite, and then we're not allowing ourselves the opportunity to share the information properly. We're being the message instead of just getting them in front of the information where they can make that yes/no decision. I hope that these 15 minutes really help you take at least one or two nuggets on the invite. We will roll back to this topic here in probably a month and a half. So you're going to hear somebody else give you more nuggets on the invite as we go. But I want to leave enough time that we get Dr. Melody Rodarte on the call. Absolutely amazing couple. Her and her husband, we first met them actually in Costa Rica. It was a great incentive trip that they qualified for. We got several nights where we were just hanging out, getting to talk with them and kind of learning who they are. I can tell you they're incredible people. I wish they were directly in our organization, but it's always fun to meet cross-line people that you could do life with them, that it's going to be a lasting relationship. But Dr. Rodarte, she's board certified in internal medicine, specifically obesity medicine, certified in hyperbaric medicine, wound care. The part, the medical side of it I love, but the family side of it, that's where I think these two shine. Her and her husband, they've got twins, boy and a girl. They're both 14. Her husband is a investigator, I'm not using the right term for Tony, a detective is what Tony is. They love to travel and just be around people. They're passionate about preventative medicine, and they enjoy doing medical missions. So I'm going to bring Melody onto the phone as soon as I see her. Melody, can you unmute yourself, or do I have to? Let's see, I got you.
Got me?
There we go.
Okay,
All right,
cool.
I'm going to turn the time over to you.
Okay, cool. Thank you so much for the introduction. And we fell in love with the two of you in Costa Rica, and I agree. It's great working with you guys, even when you're not directly in our upline. Well, I guess you're still in our upline. Anyway, so I have been asked to talk about true science, and I love the skin, and it became really passionate to me once. I did not have acne as a child. I got acne after I had kids. So I had to learn how to deal with it, and then starting primary care. My patients would want to know what to do with their skin. So it became a secondary passion to me. And what I want to give you guys all, first of all, tonight is have the posture about talking about this, because there's so many things out there. The first thing we learn about Protandim is there's nothing else out there like that. Well, you can feel the same way about true science. It is nerve tube activation of the skin. And because of those LSU studies, you have PubMed right away to go to talk about nerve tube of the skin. And so the skin is the largest organ in our body, and it's our first defense mechanism. So we want to take care of it. It protects us against pathogens like viruses and bacteria and environmental factors like the sun and pollution, and it regulates our body temperature. So we want to take care of it, and it's great that we can use something to protect our bodies from that outside environment, outside into inside. And our skin shows our age. So I tell a lot of my patients, I'm going to grow old kicking and screaming. And now we can do that from both inside to out and outside to in with Protandim and True Science. So True Science, the cool part about this is it is the first patented skincare line since retinol 12 years ago. So nothing new had come out. There are new products. And if you do skincare, you've heard of growth factors and peptides and serums and lotions, but True Science is the first patented since retinol 12 years ago for specific aging. And we are patented, so you can show somebody the patent on True Science as well. And so you should have that posture of going, we do have something different. And it is a new category by preventing and repairing damage that oxidative stress will do to our skin. And every cell, it can be affected by putting True Science on it. So we have, that top layer, that stratum, that's kind of the dead stuff that protects our skin. And then we go down to the epidermis and the dermis. And it's just incredible that we have something to help our skin out. And so when someone wants to know, well, what's in it? It's that almost like Protandim for the skin. And there's a couple really cool things in there that do more than just the Protandim herbal ingredients that we know about. So Plantigo, it improves our skin quality and by improving the elasticity and the firmness. And so that helps with the smoothness, I can't even say the word, and the texture of our skin. And then the Brassica family, and that helps against cellular stressors, and it has a fancier word in there called isothiocyanonides. Say that 3 times, and it protects against the environmental factors. So not only is there Protandim, and they use the black pepper part that's in there, and that helps by decreasing pigmentation, but then there's the Plantigo and the Brassica family. And so if you've seen in your back office or ordered them, I don't know if you can see this, those all kind of have those fancy words in there if you like reading about it. And then those that really love skincare and go, okay, I need more than just pigmentation. I need more moisture. Well, we do have that. We have Caragens, which are red seaweed that helps with the moisture of our skin. And then Dr. Chevreau is even more awesome because she's going to hopefully get that patented what's in the eye gel, and that's the Beautify in it. And there are specific ingredients that help the puffiness and the dark circles around the eyes. And I think that's one of the most common things that my patients want, or their crow's feet and kind of the dark circles. So we have something that sometimes people just want to start with that and see what happens. But when we activate Nerve2 in the skin, we're helping hydration, and that's by increasing the desmosome layer, making it a much better layer there. And we are helping the collagen, so through keratinocytes and fibroblasts. Those are two cool words you can talk to people about. And so that helps you make 4x4s instead of toothpicks for collagen. And so then your skin looks, nice and smooth, and your wrinkles don't look as deep, and sometimes the really fine ones go away. And then of course it's UV protection. So the study showed that it had great protection against UV damage. And so the next question a lot of patients ask me is, do I have to wear my sunscreen still? And I tell them I've switched to a physical block because I don't want a chemical block anymore with me using True Science. So I look for a physical block, and a lot of times you want to look for something that has the Skin Cancer Seal of Approval. That's covering both UVA and UVB light, and so you're not it's just sitting on top of the skin and helping protect from UV light. And then Nerve2 activation helps decrease pigmentation. It helps with that antioxidants, reduce the cellular stress that is undergoing, so then the cell can act normally there in the skin. So the epidermis and the dermis looks more organized again instead of like a blob of cells. And then your cytoskeleton looks better. You're protecting your DNA, so hopefully decreasing the chance of skin cancers or pre-skin cancers, and helping decrease remodeling. So hopefully, in a nutshell, that kind of gives a little bit of what Nerve2 of the skin can do. But the coolest part is having that posture of we do have something different, and nobody else has Nerve2 activation of the skin. And I'll tell you on a personal note, it really helps when people have, I know some of us out there, we have pictures of people who have burns or psoriasis and eczema. We're not meant to, treat, cure, prevent, mitigate any of those, but we're just allowing the cells to have decreased stress on them so they can start to act normal.
Love it. I love it. I love hearing the experts talk about how this science actually works. I'm just the finance guy, so a lot of that goes over my head. But when you listen to the excitement of a doctor talk about, how important this is, it just blows my mind what we have our hands on. If somebody was to ask you, like 1 or 2 bullets of the skin cream, what would you say are probably the top 1 or 2 bullets that they should know about the skin cream?
I think the main points about the skin cream is just that hydrating, anti-aging factor by reducing the stress. So that's the biggest thing. So many people want an anti-aging cream that works. Well, ours does by activating that Nerve2 of the cells. And so a lot of times we try to eat right for our skin, or we'll go in and do procedures, but it's really difficult to get something to go all the way down and be absorbed all the way into the skin. And our anti-aging cream has been shown to do that. So it's going all the way down deep into the basement membrane and helping those cells that are there, creating the structure for everything above it. That's the key point is we are affecting it. We are affecting it in a positive manner.
Nice. So it is actually the outside in approach. It is getting from the outside to the inside. If you were to suggest as people get started on the system, would you suggest that people are taking before pictures?
I think it would be great if they did, because a lot of times they won't notice those subtle things, especially around their crow's feet and kind of the puffiness. Those are the first areas to really show any difference. So I think before and after pictures are great because it'll, or if someone has like a dark spot, that's even better to kind of follow along and see what happens after 30, 60, 90 days. And, you know, in our back office, we've got some great pictures too, little slides showing what the cell looks like of the cells and what happens to them. So Dr. Chevreau is great with putting that together for us to use as a visual, because I think a lot of people have never seen a slide like that. So it's nice. I use it all the time with my patients.
That's awesome. And I really do think that if people integrate the before and afters into new customers or new distributors starting the regimen, that's how you're going to get a customer for life. When they can visibly see something happening to themselves and have that 30, you know, the before and then the 30, 60, 90 day tracker, get them to commit to using the regimen for that full 90 days and taking those pictures at 30, 60, and 90 days, and they will see a difference. They absolutely will. One of the things that I found interesting talking with Natalie Chevreau on it was she was telling me how it's unique in the marketplace because a lot of skincare products, they get rid of the fine lines and wrinkles by actually creating inflammation on the skin. It's not helping the cells. It's just irritating it and causing puffiness. Is that correct?
Yeah, that's really correct. And a lot of women won't use Retin-A or retinols or retinoids or so many different formulations because of the inflammation too. And so this gives us another option for those who can't use retinoids for anti-aging. We don't cause inflammation. And so if someone comes up and says, oh, I've got sensitive skin, the best thing is have them put it like right here. This is kind of a sensitive area, or behind the ear, and see if they have any redness or inflammation. The first thing I do when I'm telling somebody about it is I have them even just put it on the back of their hands. And you'll know women, they always like smell. So they're like, ooh, that smells wonderful, you know? And then they like to kind of keep touching and seeing how soft it feels after, by the time you're talking about the whole system. But that is the key to a lot of the over-the-counter products where people are thinking that they're reducing fine lines and wrinkles, but it's actually the inflammation or the silicone or that are filling in the lines, and so it looks great. And then you wash your face off, and you wash it off, and you've got the wrinkles again.
So this is actually getting to the root of the problem and getting the cells back in the right structure that they used to be in.
Yeah, and the best analogy is really telling them you're making 4x4s instead of toothpicks. It's a great analogy of what's going to lift up the wrinkle the best. Toothpicks or 4x4s.
I love it. I love it. And you made a great point where you're talking about carrying it around with you so you can actually put it onto somebody as you're having that conversation. And that goes right in with the invite that we're talking about, you guys, is when you have the products available for somebody to have instant access to them. And granted, that doesn't work with, NRF1 or NRF2, but Axio and True Science, it absolutely does. Get it into their hands. Let them feel what it feels like, that silkiness, the smell of it. There's very few people that don't like or aren't attracted to the smell of our skincare system.
And I'll carry around the little packets too. So of course, when I'm seeing my aesthetics patients, I have the whole system in front, but the little, I call them to-goes. And I was getting a pedicure the other day, and I was like, oh my gosh, I've got something for you. You never know. I didn't go out to prospect. I love that. I'm going to start using that. You said that you end up, what would you say? You prospect while you're out. So I'm getting this pedicure. Not even, a lot of times I don't tell people I'm a physician, because then I don't get to relax, close my eyes. I end up getting all the questions, and hey, there's a doctor here, let's ask her questions. Right. So she's had this skin issue, and so I got to pull out a packet, and she told my girlfriend about 2 days later how it was helping her. So it's just amazing to be able to use those, and that is definitely something right away that you can do, where you can't really sample Nerf 1 and Nerf 2.
Love it. I love it. Well, I can tell you, as you were talking, I was scrolling through the people that still had their video on, and a lot of heads were down, pens to paper, taking notes on what you were saying. So absolutely love your knowledge, your expertise in delivering this information. I really hope that people over the last 30 minutes, I really hope that you were able to take some nuggets away on how to do the invite, how to talk about the skincare system. And I just absolutely love this format. You on board with this, Melody?
Oh yeah, I love this.
Perfect. All right. Well, we'll get this recording out to all of you. Have an amazing week, an amazing month end. Don't forget it's month end. Check your back office. Make sure your PVs where it needs to be, that you have your personal order out there, and that you are going to get paid what you deserve to get paid. So make the month end strong. Let us know how we can help, and we will see you next week. Thanks, everybody.